We're continuing to visit businesses around New York that are reopening after having been shut down during COVID. This week's focus is on hair salons, barber shops, what you need to be doing to make sure that you're safe and that anyone around you might be safe as well. We are here with Dr. Maryrose Laguio-Vila, the Chief of Infectious Disease at Rochester General Hospital, to talk about some of the safety measures people should be taking before they're coming back out to the hair salon. Thank you so much for joining us.
Thank you for having me.
Just to start with, when people are coming to the salon now, getting ready to head inside, there are going to be other people. While there won't be as many, what is the number one thing that they should have on them at all times, just to make sure that they can always practice the safe measures they need to?
Well, I think as the patrons, the safest things to do would be to bring your own mask, to bring your own hand sanitizer, and also just be cognizant of how aware is the salon that you're going to. How are they practicing the social distancing that's recommended by the state's Department of Health? The Department of Health has a wonderful website with very specific recommendations as well as best practice guidelines of how to implement some of these social distancing measures.
Let's head inside to see what Strands Hair Studio has done to make sure that the public is safe. Inside, we see, you mentioned signs. There's practice social distancing signs. We see hand sanitizer, wipes, face masks, just in case anybody forgot them. Are there any other questions that customers maybe should ask the owner before they come in, just to make sure everything's being done correctly?
Well, you might want to ask them, do you have the opportunity to pay before your visit or pay electronically, so that way you can minimize taking out your wallet or touching a touchpad to pay with a credit card. You may ask them about, do they change their schedule? Because some opportunities to minimize how many people are in the shop may be to stagger appointments, provide enough buffer time in between appointments so that they have enough time to wipe down and sanitize chairs and workstations. You may also ask, do each of the stylists have all of their own individualized utensils, so they don't have to share scissors and combs among other stylists or with other patrons?
Speaking of utensils, I feel that a big topic point, something not everyone necessarily agrees on, is the blow dryer. Some people are using them, some people are not. Is there any rhyme or reason? What is the actual rule when it comes to the blow dryer?
Well, at this time, because we don't have enough information, I don't think there's a firm stance on the blow dryer. Clearly, the blow dryer is integral to hair care, but I don't think that we have enough information to say it's an increased risk for anyone in the store. And because we do need to find some sense of normalcy, I'd still say that we need to continue to practice the backbone of protection. It's expected that people who are getting their haircuts will wear their masks, and there should be some honor code of, if you feel unwell, flexibility to cancel your appointment with no penalty. And the same should go for the employees. If they feel unwell, they should feel supported if they have to call out because they don't feel good.
When people are heading into the salon, is there anything that they should leave in the car or not bring inside with them? Should we be limiting how much stuff we're carrying on us at a time?
Well, I think that I would only bring in the essentials. And I would say that the essentials may be just, if you can't pay ahead of time, just bring in what you need to pay for your visit. You can bring in your phone, but I would have personal wipes available if the store doesn't, so I can wipe down the phone at the end of my visit. I probably would not bring in a book or a magazine that I might leave on a counter while something is being done, because those items don't sterilize well.
Some people are still a little nervous to head back out there to go to some of the businesses that are reopening. What would you say to those people? What's a bit of advice you might have?
First, I'd say it is very rational to be worried. You know, we have gone through a pandemic that we humans haven't seen for 100 years. So all of us, if we really know and see it, we should be concerned. but we've learned so much as about what to do about cleaning and minimizing catching it from the environment and from each other, that I think that if we all want to get back to some sense of how business and interactions and going out to restaurants once were, well, we have to capitalize on all the information that we've gained. And I honestly think that the New York State Department of Health website has a very useful set of tools. They outline the different types of businesses according to each phase of what types of guidelines and signage and precautions that they should take. And especially if you're going to a business and you can see that clearly that business has taken those guidelines seriously, and you can see signs and that they physically distance their patrons, that they provide free samples of masks and easily accessible methods of hygiene. These are the kind of things that should ring true, that the person owning the business and running the business cares about their staff, cares about their patrons, and is doing what they can to build some sense of normalcy back in society.
I've heard a lot used with the term risk level. What is the risk level of this or that? How would you categorize heading back out to the hair salon or the barber shop?
I think overall, the hair salon, because it does require proximity between two individuals, it has to be graded as moderate. But that doesn't mean that it has an impossible task of being able to accomplish the business that it needs to do.
When the customer is getting ready to leave the salon, they're getting back in their car, they're going home, are there things they should be doing before each of those things once they exit the building, once they get in their car, once they get home?
Oh, well, I think what they should do is hand hygiene. Have they had their phone out? Did they have their credit card out or their wallet out? Wipe them down with any of your sanitation wipes that you could use. And, discard your mask if you think it in any way got contaminated while you're there.
I'm now inside Strands Hair Studio with the owner, Donna Moak, to talk about some of the changes that they have made since restrictions were lifted after COVID-19. We are practicing social distancing here, so we don't have our masks. We do have them on us, but Donna, what is the first thing that people need to know? I know before they even walk in, you have to have your mask on.
Correct. What happens is that we have our clients go outside, stay outside and call us, and then we walk out to get them, and we make sure they have their masks on before they walk in. We make sure we sanitize the handles of the doors, and then we just have one client at a time.
When someone calls to make an appointment, what is it that is gone over with them over the phone about what they need to expect that's different?
Well, we're following all the CDC recommendations. So the first thing is that they have to have a mask. It has to be a disposable mask that goes around the ear, so that we can, be able to cut without taking it or untying it from the back of the head. Also, we need them to know that they're going to have to sign a statement that says that they haven't been around anyone that tests positive for COVID.
You mentioned that you will go out and get the customer when they're here. When they arrive, do they have to do anything specific? Do they just wait? Do they have to call you? What happens?
They call us first, and then we go out. The stylist waits till they're done. Their client that's been in their chair, we cash them out, we get them ready, and we make sure that that client is finished 100%. They leave, and then we bring the new client into the salon. We don't want to over populate the salon. We want to keep it as social distance as we possibly can. We're in small spaces. We're working at half staff, and we're not putting any clients in between clients.
You mentioned working at half staff. Are you then trying to separate the hairstylists as much as possible from one another? I know I see some of the barriers in between the stations.
Yes, we're separating them, and they're working 6 feet apart. So we push in the middle chairs, anything that's close, if we needed something where a mother and a daughter with assistance comes in and we need to pull something out, we can social distance and move the barriers in between them. But we are keeping we're keeping it as empty in here and as 6 feet apart as we can. We took the waiting room out to make sure no one sits in here, and we keep it comfortable. That's our main goal, is to keep it comfortable. Our clients have been here a long time and they're like family to us. It's our top priority.
And I know I see at each station there's a bottle of some kind of a cleaning mixture. Can you talk to me about what that is and what needs to be done in between each client?
Okay, that is Lucicide. It's a hospital grade CDC approved disinfectant. And what we do is we spray everything down with it. We do the chairs, the surroundings of the chairs with the Lucicide when the client gets up, and then we cash them out and we wait the time frame before we bring in the next client. So we're making sure that we're following all the CDC guidelines. We're also, all our stylists, before we open, we made sure we were all certified in the Lucicide disinfectant. So we all went online, we all took a class, and every one of us has a certification as to how to properly use the disinfectant.
And tell me why it was important that you and the rest of the staff were certified.
Well, through this all, our main concern was to make sure that our customers were as safe as they possibly could be in here. We just want to make sure everything's clean and sanitized, because our customers are the most important thing to us, and we want our customers safe.
So we talked about, disinfecting, cleaning. I know I see hand sanitizer as well at every station. Is there any kind of protocol that people have to follow when they come in? Do they have to use it first thing, or is that just on a need-be basis?
Well, we're wiping our handles down. We're going and getting our clients. We're sanitizing before we do that. We pump sanitizer in their hand when they come in, and then they fill out our forms with clean pens.
What are the biggest changes when people walk in that they will see? What is the biggest difference from before COVID to now?
The biggest change is the amount of people in here, the amount of clients are in here. We used to have every chair full, and our stylists booked in between their clients. So we always had 2 people per client. So there were just clients everywhere. And the customer service items, like we used to be able to offer them a magazine and coffee and a water, and now we can't do that. We're allowing our clients to use the bathroom. They have to wash their hands. There's all the CDC signs in the bathrooms.
Same question with blow dryers. I know there's a lot of discussion about whether they can or can't be used. Some salons are, some aren't.
Yeah.
What are you doing, and what have you read?
Yeah, that they're permitted, and we're servicing our client from the beginning to the end. We are blow drying and finishing the hair, because the CDC guidelines say that we can.
You mentioned wiping down the chairs, any equipment. What about smocks? That is one thing that is shared from person to person.
It's not shared here. Every single smock is washed from client to client. We have enough that we can go all day and keep washing them.
You mentioned that you can't overlap appointments like you used to. I know when I would be sitting getting my hair done, someone else might be getting their hair colored before COVID. Have you extended hours at all because appointments are more spread out and you're not necessarily bringing in as many in a day?
Yes, my girls have been extremely flexible, and I'm so grateful for that. We've even opened on some Sunday hours. And normally we close at 8 at night. We've been staying here till 9. We've been working Saturdays later, and we've been putting in Sundays hours. So really we've been accommodating the customer, and we've even had customers ask if they could be in here by themselves, our customers that are a little more nervous. And we've even accommodated them and brought them in like on a Sunday when no one else is in here, and it's just a one-on-one.
Thank you so much for
All
joining me
right.
today.
Oh, it was my pleasure. Thank you.